Hello, and welcome to PEGTV, 98.1 JJR and AM 1380 WSYB. I'm Terry Jaye, Operations Manager at Catamount Radio, and today we've teamed up with PEGTV for an important informational, broadcast to let you guys know what's going on with COVID-19. And we are lucky enough to have two fine representatives from the Rutland Regional Medical Center. Dr. Rick Hildebrant, Medical Director of Hospital Medicine and the hospital's Chief Medical Information Officer. And today he is joined by Jody McIntosh, the Hospital Infection Preventionist. Now that would seem like you guys both have your hands full right now. Dr. Rick, we were just saying it seems like it's Groundhog Day. We were just here back in April. We did a few of these meetings before, and here we are again. And today we are even further apart than we were the first times, and we're all keeping our masks on today as well.
That's right.
We're taking this totally seriously, and we took it seriously then. And I have to thank you guys as being part of the great state of Vermont, because you guys, along with the other regional medical centers and scientists and the governor, you guys got things done. We were #1 for a reason. So before we go any further, thank you. Thank you both for what you do.
Thank you very much for that, Terry. It means a lot.
Well, you guys mean a lot to us. Let's start off with the news. The status of the virus in our community. I'm hearing things out on the street. There's stuff on Facebook. We report it on the news. It's in the paper. It's here. It's in our community. And we hear everything from students being affected by it. Sadly, we've had 2 deaths. How are we handling this? Where are we going to go from here with dealing with the situation that we have in our community presently?
Right. So, Terry, we do have a much larger number of cases than we've seen in the previous months. Today, VDH just reported the case reports from yesterday. We have the highest number of new cases that we've ever had at 148. We have a number of individuals in the hospitals around the country, around the state, so 17 in hospitals and 1 in an ICU bed. And overall, we're at about a 2.1% positivity rate for the tests that have been collected. In Rutland, more locally, our cases are at 3 new cases from yesterday and 59 positive cases in 14 days. So much higher numbers than we've seen in the last several months. It is our expectation that those numbers will continue to rise. The reason for this is in part because of cold weather. When the weather becomes cold, we spend less time out in the outdoors and more time indoors with other people. Also, the recent Halloween holiday has likely increased that spread as well. It's important to know that this is a disease of clusters, so the majority of these cases are in identified clusters. So Rutland Health and Rehab, as many of you have probably read or heard, is undergoing an outbreak where a number of their residents are positive. They also have a number of their staff people that are positive. And that accounts for a large number of positive cases in our county and in our state. And when we see other outbreaks, it's generally in clusters. So it's a family group that becomes infected, or some kind of social gathering where the virus spreads. What we have not seen is widespread community spread. So spread that is due to casual contacts. That is occurring in other places around the country, but we have not seen that in Rutland, and we have not seen that in Vermont. And it is our severe hope and goal to prevent that from happening, because that's when this virus can really become out of hand.
I have to say, Jody, the Hospital Infection Preventionist. Now, that is a title that has the weight of the world on your shoulders. How do we, not just at the hospital, but how does the average person stay safe from this? Nobody wants to bring this home. Nobody wants to infect their grandmother. What are some of the protocols that you recommend for all of us?
Yeah, so I think the best thing you can do is continue to listen to the governor and make sure that you are paying attention to any of the news and the recommendations that's coming out from Vermont Department of Health. Anytime you're in the community or around somebody that you might not necessarily live in your home or sleep in your home, you should be wearing a mask much like we are today. You should also make sure you're washing your hands if you're going to the grocery store, making sure you wash your hands when you get home. And when you're in public, try to remain at least 6 feet apart. And limit your travel. We have travel restrictions here in the state of Vermont, and that also includes traveling to places that you don't need to go to in the state of Vermont right now. So if you don't need to go to Costco's to shop in Burlington, you really shouldn't. You should be shopping locally, and that was something that came out as a recommendation last week. So,
You know, when we first started doing these meetings, I actually showed up with rubber gloves wrapped in a cocoon. I mean, and since that time, Dr. Rick, you and I talked, that first one, I let my guard down. I mean, when we first started this, guys, I was going to the grocery store, leaving the groceries in my garage, anything that didn't have to be refrigerated, left it there for 3 days, and then the stuff that had to be refrigerated, we wiped everything down before we brought it upstairs. Are we still doing that?
Yeah, that's a great question, Terry. So the main way that this virus spreads is via droplet. There is certainly in some cases and in some individuals where the droplet spread is worse or it's airborne. But droplet precautions are really the most important, and that's what Jody's talking about, where wearing a mask will prevent you from spreading these infective particles out of your mouth and around the area. It's really one of the most important things we can do. Washing your hands is incredibly important as well, because that is how you will infect yourself. You will touch a surface that's infected, like a doorknob or a handle, and then touch your face or your mouth. Those things are so much more important than keeping your mail in a bag for 5 days or preventing yourself from putting groceries into your pantry. Those are relatively lower risk things. And given that there's not widespread community spread right now, I wouldn't recommend doing those things right now. I would recommend, as Jody mentioned, masking, distancing, and hand washing. And we've been saying this for a long time, but I want to just give an example of what that really means. It means when you go to work, put a mask on and wear that mask all day long. It means when you're at work and you're taking your lunch break, don't sit around a table eating lunch without your mask on around your coworkers. We have seen around the country time and time again break rooms as a common area of spread. So you have to wear the mask, you have to wear it all the time. You can't be in these congregate areas where you're unmasked. If you need to take your mask off to eat, make sure you are away from other people. Because that's where this thing will spread. It spreads in clusters.
Well, I'm thinking of all the things I do at work now. And thank you for that, because I'm sure that I'm not alone.
Right.
Speaking of eating, we're heading into the eating holidays. We've got Thanksgiving coming up, Christmas, New Year's. This is when, I guess I'm a hugger because I miss hugging people. Grandmothers, kids coming home from school. I mean, there is so much pain for people not being able to get together. How are we going to, Jody, how are we going to get through the holidays?
Yeah, so we have discussed this at length and at the hospital. And some of the creative things that we have thought of is, setting up Zoom or Teams meetings with your family members. Everybody has that favorite grandmother recipe, and many people get together to cook the night before Thanksgiving. So this is an opportunity for you to cook with your family at your own homes. You could also do the same thing for mealtime on Thanksgiving. And you should not be eating meals at Thanksgiving with people that don't live and sleep at your own home. Other things is just being aware of how you're feeling and making sure that you're taking care of yourself and your own wellness and health. Dr. Hildebrant?
Right. So, this is definitely going to be a different year for Thanksgiving. And one of the quotes that really spoke to me was something by our governor a couple of days ago, and I'm going to repeat the quote for those of you who didn't hear it. Real patriots serve and sacrifice for all, whether they agree with them or not. Patriots also stand up and fight when our nation's health and security is threatened. And right now, our country and way of life is being attacked by this virus, not the protections we put in place. Our healthcare workers across the state have been on the front lines battling this thing from the very beginning and will continue to do so tirelessly to meet the needs of our communities. But we cannot do it alone. We need the help of our entire community, of our state, to protect our families, to protect our loved ones, and to protect our neighbors. At the Hildebrant household, I can tell you Thanksgiving is a big event. We do a large dinner. We have a lot of family members there, and it's a celebration of our family and of giving. And this year, my wife and I have chosen to give the gift of health, safety, and the gift of holidays yet to come. And we're going to do that by embracing a digital Thanksgiving, and I ask that you do the same.
I was saying the other day to my coworkers, whatever you guys do for Thanksgiving, I'm going to be doing for Thanksgiving, because you're going to be coming in here. So if you have a big party, you're bringing that party in here. It's like, it's like going back to sex ed in 7th grade. I mean, if you're going out and meeting and greeting everybody out there, you're going to be bringing it all back to us. So I'm hoping that coworkers have this conversation in the workplace amongst themselves, because that's really what I'm trusting you guys, please. Kids coming home from school. Okay, they haven't been sleeping at home. They've been in their dorms. What do we do when junior comes home for college? Right.
That's a very common question that we've seen in our hospital and by many in the community. So a lot of families have loved ones, dependents, who reside in their house for the holiday season. They're coming from areas outside the state, and that requires a quarantine. So how do you do that? What that means is that the person who's coming into the state should limit their exposure to the rest of the household until either 14 days have passed or 7 days in a test. So as an example, spend as much time in your room or away from others as you can. Use a separate bathroom. That's probably one of the most important things than the rest of the household. If you're around the rest of your household, you should be wearing a mask indoors. And you really should not be sharing meals until that quarantine time has passed, okay? Isolation is another term that's sort of touched upon. That's different than quarantine. Isolation is you are in your room, you do not leave, you do not interact with anyone. But you should quarantine if you're coming from out of state until either, again, a 14-day has passed or 7 days in a test.
If we can get back to some statistics, how do we stack up in Rutland County compared to, say, the rest of the state? We know everybody's going up, but are we doing okay? Or do we need to work on it a lot more?
So prior to the last month, Rutland County was doing very well, and everybody in the community was working very hard. And more recently, we have moved up. We are kind of in the middle to the top of the pack now. And that, to me, just really speaks to everybody digging deep. It is a hard time of year. It's getting darker out. People are moving inside. We've got the holidays coming up. But just digging deep and going back to the basics that we've been talking about today.
And I don't want people to get the impression that it's that people did things wrong, and that's what caused this. As I've mentioned, this is a disease of clusters, so we've had some clusters, right? One very large cluster, which has made our numbers, population-wise, higher than they certainly were a couple of weeks ago, okay? You know, when I go to the grocery store, I feel very proud when I step in Hannaford's and I see everybody wearing a mask and people following the aisle directions and spacing at the checkout. That is great behavior, and I'm very encouraged to see that. It's hard to continue to do this for months and months and months, but people have been very diligent with this. So the fact that the numbers have increased in our county, while certainly concerning, and certainly there's more risk now than there was a month ago, a lot of this is attributable to clusters of outbreaks. So the overall risk in our community is not dramatically higher, but it certainly is higher than it was in the past month. The other thing, just to note, as Jody mentioned, a couple of weeks ago, I was looking at VDH's map, the Vermont Department of Health, where they look at county counts from as far south as Virginia and as far west as Ohio. And a few weeks ago, we had the lowest case counts in that entire region, inclusive of Maine. So we have done well in this community, and I know that we can all band together and continue to soldier through this.
Now, we talked about the fact that we do have COVID-19 patients at RRMC right now. Do we have?
Right, so we have had COVID-19 patients on and off for many months. And, you know, anytime someone who comes in who needs care for COVID-19, of course, if they need inpatient level of care, we'll provide it.
Now, not everybody that has COVID-19 has to stay in the hospital, right?
That's right. And one thing that we've seen across the state is less cases that require ICU level of care. So I mentioned, you know, as of today, 17 hospitalizations across the state with one ICU bed. That was not the case in the spring and the summer. It was the majority of these cases were requiring ICU level of care. There's a whole host of people who never get hospitalized or never even have symptoms. So I would say the overwhelming majority of people who test positive do not need hospitalization. They certainly should call their primary care physician if they ever receive a positive test to make sure they get appropriate guidance. But most folks do not require that level of care.
Jody, we talked about quarantining and Junior coming home from college, and what if I think I've been exposed to somebody that may have it? Should I isolate myself at home? And if I do, how long do I have to do it for?
Right, so the first thing you should do if you feel you've been exposed is call your primary care provider and describe the situation with them. They're either the provider or their triage staff will help you determine if you've had an exposure. And if you've had an exposure, the usual recommendation, as long as you're asymptomatic, is to get tested around day 7. If you were to get symptomatic during that time frame, you would want to call your provider back and let them know. And the recommendation at that time would be most likely to get tested.
Okay. So as long as we're on the testing situation, how do I get tested? Where do I go for a test? Does it hurt? I mean, I'm the coward. I'm asking the question.
Sure.
Tell us about tests.
So, you know, the first and most important thing that people need to know is if you have symptoms, it's really, really important to not go and just get tested on your own. Talk to your primary care provider first, because you may require care. And that is really the number one recommendation is if you have symptoms of COVID-19, call your primary care doctor, allow them to triage the situation, and they may recommend testing. If you are in one of those scenarios where you are required to quarantine, like let's say you had a travel from outside of the state, or you did travel outside of the state, and you're on a 14-day quarantine, it is absolutely reasonable to get a test on day 7 to end that quarantine early. And there are a variety of ways that test could be done. You could, of course, call your primary care provider. the Vermont Department of Health has expansive pop-up testing sites, and also have expanded capacity in local sites, such as at Rutland Regional Medical Center's specimen collection area to allow for that testing. All of that is coordinated by the Vermont Department of Health. So if someone is asking to be tested for that scenario, they've traveled from out of state and they're on a quarantine, I would encourage you to go to the Vermont Department of Health's website. You have to register and select a time slot. These are all scheduled time slots. The other time where it's a very common scenario to get tested is if an employer is asking for it. And many times we have our employees tested, and other employers may ask for you to be tested because of either symptoms or exposure. And those are all reasonable things. The test itself, I can speak from personal experience. Is it painful? No, it's not painful. It's not comfortable though. This is a swab that goes deep into your nasopharynx, so into your nose and back into your nose, which it's uncomfortable, and it has to stay there for a period of time. So is it painful? No. It causes some tearing, and it is a bit uncomfortable.
Okay. I can do this if I need to. Thank
Absolutely.
you. Let's talk about Rutland Regional Medical Center. How prepared are we? How prepared are we right here?
Great question. Jody, you want to start?
Sure. So we are very prepared to care for you if you are sick with COVID-19. We are very prepared to continue our services that we have in place in both our inpatient and outpatient services. We have worked very hard to make adjustments to our environment. So we have increased the number of negative pressure rooms that we have available. We have adjusted our disinfecting processes in alignment with recommendations from the CDC. And we have what we call personal protective equipment, so PPE, and we have plenty of that available for our staff. We also have increased the number of education sessions for our staff so they are competent and familiar with donning and doffing the PPE. And then any employee that we have that's hired into Rutland Regional Medical Center, we offer them COVID-19 education, and we really focus that education on a safe and healthy work environment.
So another message just to say, Terry, you know, as we've mentioned, we've had a number of cases over the several months of COVID-19. That being said, we are not overrun or overwhelmed with COVID-19 at this time. That is not the scenario at the hospital. We have very stringent protocols and designated areas in place so that if someone is admitted to the hospital with COVID-19, they are not around other patients that don't have COVID-19. We make very sure that our patients are safe and that you can come into the hospital, receive care, and have no risk of exposure from COVID-19 because those patients are cohorted into a negative pressure area space that protects everyone around them. Our mission is to provide care to our community, and we want to continue to provide a full spectrum of services for as long as we possibly can, including outpatient elective procedures and the whole gamut of services that's provided at RMC. What's different this time around is last time we were forced to close our doors in our clinics and in our procedures. We don't want to do that anymore because we don't think that's the right move for our community. Those are vital services for this area, and we instead are enacting protocols to keep everyone safe while continuing to provide those services, but still caring for individuals that have COVID-19.
I have to ask a question about the tests again.
Sure.
You hear things about false positives and false negatives, and there are different types of tests. So, I mean, can we trust the tests to be accurate?
Sure. Great question. So the test that we're talking about, when I say test, I'm talking about a PCR test, which is a DNA test. The problem with the test, if you want to call it a problem, is it's too good. It's very, very sensitive, which means that it will pick up this virus even if it is no longer infectious, if it's a clump of DNA that's dried in a booger in your nose, okay? This thing is going to pick it up, okay? So if there's any sort of problems, if you will, it's because it's so sensitive, it picks up any amount of DNA that's positive for this. The errors or concerns we were seeing early on had to do with sampling. So as with any test, it's only as good as the sample collection. If you're doing a blood test and you do the blood draw incorrectly, the test may be in error. And the same thing is true of this. You do need to get a nasopharyngeal swab in most cases to get the sample appropriately on the swab. There are other testing modalities that involve just the nose that are also very sensitive, but it uses a different protocol. There is another type of test, which is called an antigen test. An antigen test is much quicker to come back. It really only is valid for people who have symptoms. Symptomatic patients with COVID-19 have a much higher amount of virus in their nasopharynx. So if we do an antigen test in those individuals, it's a very good test, but people who do not have any symptoms, it's not a very good way to pick up the virus. So most of the testing you'll see is the DNA test, the PCR test, and that's what we predominantly do at RMC. Other employers may use antigen testing for symptomatic individuals, which is also appropriate.
You mentioned that the hospital still goes on. There are still emergency surgeries, healthcare that has to be taken care of. If I have something going on with me, I should not delay it. I should make sure that I keep going, or should I, there are some people that say, well, I'm not going to go, I don't want to get COVID.
Right. So we have implemented a very strict screening process, and you will recognize that when you schedule your appointment. You get screened when you schedule your appointment. You get screened at the entrance of the building that you're going to. We have made some accommodations for the waiting rooms. We've limited the number of people in the waiting rooms. And we have also partnered with our environmental service team again to increase the number of cleanings we're doing in all of our buildings. Additionally, you might be asked to wait in your car for your appointment, and that is for your safety, and they'll let you know what time you can come in.
To be honest, Terry, the hospital's one of the safest places I feel going every day, because I know, everyone's screened with both temperature and a symptom screening, that patients are all tested who are admitted or in the ER, that our air handlers allow for so many air exchanges to filter the air of any possible virus around. It is one of the safest places to be in our county. Are there COVID-19 patients in the hospital? At any given time, there certainly could be. Those patients are isolated from the rest of the air in the hospital. They have their own air supply and filtration, and anyone who goes in there uses very specialized equipment. I feel very safe, and I go into the hospital routinely, of course, for clinical duties, feel very safe walking into the building all the time. I know that is one of the safest places I can be.
That's great news. And you shouldn't delay your care anyway.
Yeah.
I mean,
Right.
if you've got something that has to be done, get it done. What about the clinics in the area? They're still open and taking patients as well, right?
Right. So, the clinics are in full swing, and as we have looked at in the past, telehealth is an option that we continue to use, and we will look at the most appropriate venue in which to use it, because we think it's a good tool. We also know that there are many patients who need to come in for an exam. We need to do a thorough physical exam, which requires a clinic visit. And all of our clinics are embracing the technology as it's appropriate, keeping patients and staff safe by modifying their processes for evaluating patients to make sure we can limit interactions and minimize the spread of this illness. But clinics are fully open, again, very safe for patient care, to make sure that everyone gets the care they need and the time they need it without risks from this virus.
We have about a minute left. Do you guys have anything else that you want to say? A point that you want to make?
I think one thing that I'd like to close with that's important, this is a stressful and trying time, not only for those of you at home, but for teachers, for police officers, for healthcare workers. It's important to take care of yourself. Make sure you're finding that time, that you time where you meditate, or you're able to take a walk in the woods, where you exercise, get a good night's sleep, making sure you're eating healthy. Stay in contact with your loved ones. Use the technology that we have, FaceTime, Google Meets, Teams, Skype, Zoom, I don't care what it is, but do connect with others. Make sure you're taking care of yourself, because that's the best thing we can do to keep ourselves healthy and prevent ourselves from getting this illness.
Thank you both. For PEGTV, I'm Terry Jaye. Thank you, Dr. Rick Hildebrant, and also Jody, McIntosh. Thank you both, and keep up the great work.
Thanks, Terry.
Thank you.